welcome back to the morning show here on Arise News. I'm Biola Labi, and I'm here with Veronica Odeka.
Welcome back.
We're back now with Tremendoc. It's a solution that allows patients to get basic consultations by chatting or having audio-video calls with licensed doctors 24/7 via its website or a mobile app. Tremendoc is solving two problems for the patient in Africa with limited access to healthcare and the inconvenience attached to receiving healthcare, and secondly, the plague of low pay to doctors in Nigeria and Africa in general. Joining us today are the founder, CEO Jay Chikezie, and resident physician, Dr. Agbonare. Welcome, guys.
Good morning.
Hello, good morning. Good morning.
So, Tremendoc.
Yes.
It is, so is this sort of what they call virtual?
Yeah, it's a telemedicine solution.
Telemedicine.
Yeah, exactly.
Okay.
I've heard that for many years.
Yeah, true.
Are you guys the first first telemedicine
Platform in Nigeria? Not exactly.
Okay.
Yeah, but I would say we're the first to actually have video calls and audio calls. There are existing platforms where patients or users are able to ask questions, and then...
Are you a doctor?
No, I'm not.
You're not a doctor, but
No,
you're
I'm
a
not.
technologist, so you
Yes.
built the
Yeah,
platform.
so yeah.
Yes, I'm into technology, so...
So, doctor, let me ask you, as someone that came into this platform and as someone that's used to seeing patients 101, I'm guessing that's how you're used to seeing patients.
Exactly.
You're used to seeing patients 101. Was it a bit of a shift for you to think of telemedicine, or have you always felt that there could be more efficient ways of doing what you do on a daily basis?
Actually, it was a shift. It was a shift because, you know, the traditional practice is to have physical contact with patients. But coming on the platform, Tremendoc, we're trying to reach out to those that can't get access to the hospital. And, you know, we have, in Nigeria, we have cases where you have emergencies at night and you just need something to be done immediately. So rather than journey, for instance, like Lagos, rather than journey all through the traffic, you can have a consultation with a doctor pending when you get to the hospital.
I must say that, you know, I read up a little bit about this. I was applauding. As a mother of 3 kids,
Yes.
I was applauding.
Yes.
I was like, finally they're using technology the way it should be used. We're moving forward in the right way. I have little questions. I don't want to have to drive. First of all, there's traffic a lot of times. Second of all, you might live in an area where there is no access to a proper doctor. You know, I don't trust them. Who are they? I think on your app, there, you know, it gives a breakdown, a brief of each of the doctors.
Yeah.
You know, their general physicians. You know what they specialize in. I think that was really great. There's an on-call 24/7 where you can chat with the doctor. And I think I was even chatting with Dr. Uzo. It says, you know, chat with the doctor now. And so with their platform, the doctors become available. They'll let you know when they're available, and then you can log on. I think they also have like monthly plans or
yes.
weekly plans or hourly.
tell us about the
interesting.
plans.
Okay, so the models we have the pay-as-you-go. So we believe that some users just want to ask a quick question. They come in, and then we also have a subscription plan. So there's a 1-month plan of 1,500 where you have 5 sessions. We have access to 5 sessions with our doctors for a month, and then there is the 3,000 which you have unlimited access to doctors for that month. So for us, we're trying to bridge that gap where, you know, patients or users are able to have access. And the funny thing is, you'll be surprised the kind of questions that they ask
people
doctors.
ask.
You know, we have even medical students come in and say, what kind of exams should I write? What kind of
wow.
books? Yeah. So so it's just beyond even consultations.
Yeah.
Yeah.
So as your work, I mean, as you start to get these questions and you start to get this data, and you start to see what type of questions people are asking more and more, how are you going to be able to use that to almost do predictive, like?
Yeah, exactly.
Yes.
So that's the plan, to be able to work with government associations or bodies to say, looks like there's about to be an outbreak in Kano, for instance, or there's a high amount of users who complain about typhoid or
stomach
you know,
ache.
or
So you might know
stomach aches.
maybe there's a food poisoning, maybe there's a food virus going out.
Yes, exactly. So we intend to work with agencies to let them know that. So I mean, we're mining that data, and then we're able to use that beyond, you know,
Just for the
consultations.
platform. Yeah.
Yes, exactly. So
Wow.
that's it.
And so how old is the platform now?
It's just a few months old. So the main aim is beyond getting users access to doctors. We know the situation, the healthcare situation in Nigeria.
Yeah, a lot of people can't afford it.
Yeah, and then apart from that, the doctors themselves, the issues of doctors going on strike. So it's also another means for doctors to earn, on the side.
I know
So
we
how do
mentioned-
the
sorry,
I want to see how these doctors are making money.
I know. I was going to say, because remember we just talked about the fact that we're losing doctors.
Yeah, exactly.
Doctors work so hard here and they don't get paid. And then, of course, you're looking at greener pastures and you're saying, well, let me leave. So this could be also an incentive to kind of say, oh, well, I can actually make money on the side from consulting or being able to help people out. So 2 for 1.
So doctors get paid per the consultations they have. So we kind of look at it like the Uber for medicine. So when you're online. So we don't stop you from working your regular day job.
Okay.
So the plan is we have as much doctors as possible, as many doctors as possible on the platform. And then whenever you're online, users are able to favorite these doctors based on whatever their interactions with the doctors, and then you can also book an appointment with this doctor when he's offline, and then he knows that he's been booked, and then he comes online when the time comes.
So do you think that this is going to open you up to more doctors in different places, or do you think this is really going to be an opening for doctors in Nigeria?
Yes. So right now we're just trying to work with what is available to us.
In Nigeria.
In Nigeria.
Okay. So, and then you do verification of their certification. You make sure that they're board certified.
Exactly. So we are still following the regulators' rule, which is the doctors have to be licensed to work in Nigeria. And so for each country we go to, we will work with whatever is obtainable there.
And as a doctor, I mean, how do you feel that this is, I mean, when you look at this technology and you look at the addition and what it adds to our medical system, how does it feel to you as a doctor that you can reach people in far-flung places that you couldn't reach before?
I think it's long overdue. This should have happened way back. It's sad that it's just happening now, but we'll take advantage of what we have. At least you have access to consult with patients. Not patients even in diaspora, people calling from different countries, African countries, United States, USA. We've had patients all over. So it's like that barrier of only those patients living in close proximity to you, and then it challenges the doctor to read more. You're no longer restricted to malaria, typhoid, because anybody can call you for anything, and you have to be able to provide solutions.
Wow. Thank you so much. We wish you guys all the best, and we look forward to having you back. And
thank you.
I can't wait to see how many subscribers you're going to have in a year. I know there are going to be plenty more, but thank you so much.
Thank you for having us. Thank you for having us.
Thank you.
Thank you very much.
We're going on a short break. When we come back, we'll have the founder of Slum to School and a few of the kids from the institution joining us. Don't go away.